Social distancing has become a buzz term over the last few weeks, making headlines across the world. It's a term applied to actions taken by public health officials to stop or slow down the spread of a highly contagious disease or virus like the coronavirus by preventing healthy people from coming in contact with sick people. We are seeing some college campuses moving in-person courses online, suspending classes, and some worldwide events being postponed or even canceled. Officials are hoping these actions will help prevent the spread of the coronavirus. So with social distancing being encouraged across the world, I wanted to go into a neighborhood and ask the people what questions that they had that I could take to experts to find the answers. Hi, my name's Cody.
Hi, I'm Dawn.
Gabriel.
Gabriel.
Yes, we're doing it. There it is. This is what we're doing now, people. The elbow now. Okay, I get it.
Have you heard of social distancing?
I have. It's funny you mentioned that. I was looking at all the WHO and CDC, all their regulations, which are basically the same stuff. But in it, it's like we're teaching, shh, Maggie, shush. They're teaching social distancing. Everybody's creating their little personal bubble right now, right?
I feel like it's too much. If we're gonna go away from touching people, it's gonna be a whole social change, and I'm not sure I'm ready for that.
Social distancing may sound like a new term, but in fact, this term dates back to the early 1900s.
My name's Bill Hannage, and I'm an associate professor of epidemiology in the Center for Communicable Disease Dynamics at Harvard Chan School of Public Health. I think probably the most famous examples are during the 1918-19 influenza pandemic, which was truly catastrophic. We don't know exactly how many people died worldwide, but it was somewhere around the figure of 50 million. That's 50 million. When it started hitting different cities across the world and in the United States, you could see that they had tough decisions to make on whether to stop things. Like there was famously a parade. And if you cancel the parade, you cancel the opportunity for the virus to be transmitted among all the people at the parade.
Dr. Hannage goes on to say that the cities that chose not to cancel parades or events in 1918 saw a spike in the number of deaths compared to those who did.
And that's one of the reasons why I'm really quite pleased that Boston has cancelled the upcoming St. Patrick's Day parade. This is the kind of thing which is necessary at times like this.
Here's a question. How do you treat it? Right? I mean, do you just treat it like a flu? Or should be doing something different?
My name is Eric Snyder. I'm the medical director of Providence Tarzana Cedars-Sinai Hospital, and I'm an emergency medicine physician for about 10 years. So the treatment of coronavirus, unfortunately, there isn't one. It's home remedies. It's grandma's chicken soup or vegan soup if you don't like chicken. Ibuprofen or acetaminophen, which are the trade names are Motrin or Tylenol if you get a little bit of a fever. Stay well hydrated. Again, cover your mouth with your elbow when you cough, and just take it easy for a little bit. Stay home, don't go out, don't infect anybody else. And again, 99% of people in general will get over this.
There's a lot of talking about how many people will be infected. And my colleague has estimated that as many as 70% of the population, the adult population, could become infected. And with even a mild estimate of the mortality rate, that is very severe.
I would love to know how long this is gonna last. I want to know what he feels is the safest precautions for us to go about our daily lives without having to not touch people.
You stop shaking hands, for instance. If you look, there's a thing called the Ebola handshake you may have heard of, which is where you sort of bump elbows. Or indeed, you can do this. Or when my friend came round for dinner the other night, I didn't shake his hand and presented him my elbow, and he just went, I prefer the classical reference.
Should you be cautious during the flu season and viral season, which we're in now, about having close contact with your loved ones? Sure, you should have caution, but you should take the precautions that you have during the flu season. Wash your hands, avoid mucus contact, so maybe not a kiss on the lips. As long as you're washing your hands and you're not, spreading your actual saliva, there really is very little to no risk.
How would you go about taking safety precautions when you're taking public transportation?
It certainly depends on the public transportation. Certain public transportation, like airplanes, have actually really good filters, and when they recirculate the air, it is filtered and clean, and they're doing an especially good job right now wiping things down. Now, in terms of other forms of transportation, such as buses and crowded places, I think you do have to take a little bit more of a precautionary measure in terms of the people around you. And again, what it comes down to is, are they coughing directly into your mouth or your face? Typically, the mucus can be spread up to 6 feet, but certainly if they're behind you, they're not going to come over your head and make a loop and go back in your mouth. If you want to wear a mask, I don't think it's necessarily a bad thing to do. It's certainly not harmful necessarily to wear a mask in close confinement. If you have to get to work, I don't think it's a bad thing to do.
All right, Don, thank you again for joining me this afternoon. I talked to Dr. Snyder, asked a lot of your questions, and he gave me some good answers, so I want to share those with you. How you treat it is basically just like...
I'm thankful that I ran into you so you could give me this information.
That is insane.
Talked to Dr. Hanich as well as Dr. Snyder today. They both said some interesting things about coronavirus and social distancing. So I want to know what you are doing to help prevent the spread of coronavirus. So comment below and be sure to subscribe for more content like this.
It's not like the flu. It's not the flu. It's COVID. It's a different thing. Flu doesn't shut down entire countries. We have to be prepared for something which is really not something any of us have experienced. So take it seriously, but also don't panic. Do prepare.